The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Brian Brickman, IT Services Specialist at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Public Health Law Research Part 2, Developing and Implementing a Policy Evaluation Using Open Source Legal Data. A recording of Part 1 of this series is available in the Events Archive section of the ASPPH website. Today's webinar will be 1 hour in length. We will begin with an introduction by our moderator, followed by 3 presenters, and ending with a question and answer period. This webinar is part of the 2017 ASPPH Presents monthly series, which has been designed as a service to CEIF-accredited ASPPH member schools and programs of public health. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. We are pleased to have with us today our moderator, Dr. Jennifer Ibrahim, who is a tenured associate professor in the Department of Health Services Administration and Policy and the Associate Dean for Academic Affairs for the College of Public Health at Temple University. She also served as the Associate Director of the Public Health Law Research Program. Jennifer has been recognized by her peers as an outstanding teacher and maintains a research agenda in the area of health policy, including work on legal infrastructure and work on tobacco control policymaking. Thank you for being here today, Jennifer.
Thank you so much, and welcome to everyone who's here on the webinar with us today, and welcome back to everybody who joined us last time for part 1 of this series. Again, just to reiterate, in the last session, we talked about the process for building out legal data sets. Anybody who missed that, that is recorded, and I would encourage you to go back and take a look at that. What we're going to focus on today is actually moving forward from that first building block and looking at building the legal evaluations. And so we're very fortunate today to have 3 outstanding presenters who are experts in this field and have been doing this work and building this field of legal epidemiology and public health law research for the past several years. So I'm going to go through and introduce all 3 speakers, and then we will dive into the individual presentations. So first, Scott Burris is a professor of law here at Temple University. He directs the Center for Public Health Law Research. His research work focuses on how law influences public health and interventions that can make laws and law enforcement practices healthier in their effects. Scott's the author of over 200 books, book chapters, articles, reports, and certainly a well-known expert in the field. His work has been supported by organizations including the Open Society Institute, the National Institutes of Health, Bill and Melinda Gates Foundation, the UK Department of International Development, and the Centers for Disease Control, as well as several others. He's served as an expert and a consultant to numerous U.S. and international organizations, including the WHO, the UNODC, and the UNDP. He's also the founder of Legal Science, which is a private company looking at the social mission of improving access to legal information and supporting the practice of policy surveillance, which you'll see more about today. Our second presentation, Ms. Lindsay Cloud. Lindsay is the director of the Policy Surveillance Program here at the Public Health Law Research Program. She's responsible for the creation and management of internal and external legal data sets using the Workbench Content Management System, which we talked about last time. She's worked on cross-sectional and longitudinal data sets related to unemployment compensation, earned income tax credit, child restraint systems, distracted driving laws, medical marijuana laws, drug overdose, and anti-bullying laws. So clearly not only an expert in policy surveillance, but also being able to apply these methods to a range of topics. And lastly, but certainly not least, Dr. Kelly Comroe is joining us from Emory University, Rollins School of Public Health in Atlanta, where she is a professor of behavioral science and health education and epidemiology. She was trained as a behavioral epidemiologist at the University of Minnesota School of Public Health. She has over 20 years of experience leading NIH-funded group randomized trials, evaluating the effects of complex preventive interventions specifically to reduce child health disparities. Recently, she has initiated a new line of research in response to the Health in All Policies agenda. And today, specifically, she'll be presenting on a National Institute of Minority Health and Health Disparities project entitled Family Economic Security Policy Effects on Child Health Disparities. So please join me in welcoming our speakers and get ready for some great conversation. Scott?
Thanks, Jen. See if I've got the slides yet. Okay, can I get the control of the slides, please? There we go. So Lindsay and I'll be starting off talking a little bit in an introductory vein and then passing the story off to Lindsay. I'm still not able to advance the slides here, folks. There we go. Another slide going forward. Let's see what happens. Okay, well, let's see if it gets better. Am I advancing them now or is somebody else? All right, well, let me just start.
Yeah, there's just a little bit of a delay in moving them forward.
All right, thank you. Well, I'm going to talk about how important theory is to these kind of projects because just as in every other area of research, you don't know what to measure and you don't know how to measure it and you don't know why you're measuring it until you have a theory that explains what you're doing. And this is certainly true in law. So in a very broad sense, you know, we have this, well, I think of it as a conceptual interface, and I'll say a little bit more about that in a second, for public health law research or legal epidemiology, which is, you know, policy starts with policy making. We can study that and the determinants of policy. It moves on to the actual creation of a formal policy, a law, a regulation, the implementation of that policy, which we expect is going to create some kind of change in an environment or change in behavior, which are often reciprocal, and ultimately going to lead to some good outcome in terms of health, security, and well-being. But I think of this as a very abstract and as a conceptual interface tool because there's lots of different kinds of theory that you can use to explain how this process happens. And that's what I'll be talking about today if these slides will move. Okay, so now it's clearly possible to study the link between law and health without theory, and there are even some occasions when you can get good results, but by and large the messages don't. We do not want black boxes. What is wrong with this webinar today? Okay, so I'm afraid I have stuck you with animation, but anyway, so we have the challenge in constructing legal evaluation research of figuring out how it is that law influences health. What's the mechanism, causal chain of events through which the mere enactment or implementation of a law influences health? Well, using theory is going to help us in a number of important ways. It's going to define for us what it is that we should be observing out there. So not only is it going to shape selection of the specific laws that we're going to study on the left-hand side of the causal model, but it's going to help us figure out what aspects of those laws to measure. What are the important provisions? If we're making any kind of scale or index, how do we score them? How do we weight them? It's going to tell us, our theory is going to tell us, well, how is this law going to be implemented, and how do we expect that implementation to affect an observable outcome in the world? So it's going to give us implementation measures, and then, of course, it's going to give us those changes that we expect to see, those reactions to the law, particularly which ones are most important as valid measures of the effect of the exposure. And finally, what's the health outcome we expect to change because we've done this? We can kind of guess about that or think of it through atheoretically, so through some atheoretical process, but I'm going to try and suggest to you that that's not as effective as actually taking advantage of the rich range of theories that we can use in our field. So let's see if we can get that slide to change. Another important benefit of theory is that it's going to help us draw causal conclusions from the research we do. Practically everything we're going to do in legal evaluation is going to be observational. It's very difficult to randomize people to exposure to law. So theory helps us with the traditional, causal analysis of mechanism of effect. If we can point to a plausible mechanism that could create, in which the law could create the effect, and we can show that mechanism happening, then that's going to bolster our conclusion that the law is in fact causing that effect. But it's not just that. We're very concerned in law about, over time, knowing which parts of a law are important. Oftentimes we have many different provisions within a legal intervention, and some of them may be doing no good or may be doing harm, and some may be doing all the good, and we need to know that over time. And finally, also helps us both as policy implementers and as researchers in trying to figure out, well, where are we getting the greatest bang for our buck with that legal intervention. Okay. And when we learn all that, we get one of the other big benefits of doing evaluation research, which is that we can go back to policymakers and give them some guidance. Where can we change the law, tweak it? Where can we change how it's being implemented or tweak that? Or in fact, potentially where can we get rid of some parts of the law to avoid unintended harmful consequences, or just the waste of people's time complying with a law that isn't actually doing any good. All that really comes from theory, not just the results. Okay, let's see. Now, when we think of theory to explain law within an evaluation study of legal effect on health, it's fundamentally important to recognize that law is a transdisciplinary field, or legal epidemiology is a transdisciplinary field, which means that we're not just thinking of legal effects or legal theories. We're trying to understand. We can use all the theory that comes up in our various disciplines. So I'm going to give you an example of that pertaining to a big development in law over the last 6 or 7 years, the adoption of youth sport concussion laws, which started in 2009, and then a cascade of policy resulted within 5 years every state having these laws. Let's see if the slide will change. So we had a causal model of the problem and how the laws intervened. And the first thing that, of course, we noted in our causal model was that these laws were not actually designed to prevent concussions initially. They were designed to prevent people from having repeat concussions. So we worked, from the original concussion to there, and tried to figure out how it is that law makes a difference with concussions. So the first thing is, why do concussions get repeated? One aspect of this is that people don't know that their concussions are occurring. They don't detect them, or they know that something has happened, but they're unwilling to report. Another aspect is they just, they know it's happening, and, they're just not aware it's risky. It's just getting your clock cleaned, as people used to say. So all that leads to people doing a couple of different basic behaviors in this area. One is that they leave the game, but they come back too soon. Either in the game, they come back into the same game, or they come back without a recovery period, or they're never removed from play in the first place, and that's what produces repeat concussions. So how is the law going to intervene? Well, first, all these laws require that kids be removed if there's a suspected concussion. The second thing that they do is require that there'll be no return to play unless there's clearance by a health professional. So that's trying to cut off those two things. And then finally, there was a bunch of mandated health education and informed consent that was designed to get at those attitudinal factors. So now we have this logic model, and we can think about, well, how does theory explain how a law might begin to intervene? This is just logic, but let's see if we can see the benefits of theory. So one theory that everybody always wants to use when they think of law is deterrence. You're going to punish somebody, and through the punishment, you're going to get people to, as rational actors, decide that they're going to minimize their exposure to punishment by complying with the law. The problem here is that virtually none of these laws had any punishment. So the go-to theory for how law works is not going to be useful here. So another theory that you could take if you wanted to go from a legal tradition is something called procedural justice. This is a classic way of thinking about why people obey the law. They obey it because they believe they should. The law is legitimate, and therefore they're motivated to comply because they're law-abiding, and therefore they comply. The procedural justice part, which was added by a social psychologist about 20 years ago into this model, was that people's willingness to behave to comply was also heavily influenced by their sense that all the law was being made and implemented in a fair way. So if you think about that from the point of view of looking for things to measure in a concussion law, one thing you could potentially look at is to see whether the various people who are meant to obey, the coaches and the parents and the students, actually believed that it was right for the legislature to interfere with sports and how sports are played. Or you could measure whether they thought the rules were being fairly applied, so that there was no advantage across teams. And if you found those two attitudinal markers, the theory would tell you that that people were likely to comply with the law. That would work, but actually, the best fit for this area, which has actually been used in real research, was a venerable behavioral science tool that isn't really coming out of the law, and that's the theory of planned behavior. And what you see here is that if you figure out whether people believe that they are able to report, they believe that reporting is a good thing, and they believe that others expect them to report and expect them to comply with the law, that's going to lead to an increased intention to report a possible brain injury, which is going to lead to removal from play, which is going to lead to decreased morbidity and mortality, and that's what we actually found. So, the key point here is you don't have to be a lawyer or use a legal theory to enrich a legal evaluation with the theoretical framework from any one of the many disciplines of public health. So with that, I think that's my last slide. If I can get the slides to turn, I'm going to turn it over now to Lindsay.
Great. Thanks, Scott. So I'm going to shift the conversation from legal theory to actual creation of the legal data. So if you attended part 1 of this webinar series, you know that lawatlas.org, created by our Center of Public Health Law Research, is the central place for creating, sharing, and accessing policy surveillance and other related resources. So at Law Atlas, you can learn policy surveillance methods, access the tools needed to create your own legal mapping data, and also download empirical legal data from our site. So one resource that's currently available at Law Atlas is the Minimum Wage Laws Dataset, which you see on your screen. So this resource was created as part of a collaborative project with Kelly, who's presenting next, to identify the effects of family economic security on infant and child health. So to evaluate the effects of law on health, you first need legal data. So our team was tasked to read, collect, and analyze all state-level minimum wage laws from 1980 to 2016. And we were to do this in 4 months. So this project was only feasible because our team could complete it by conducting policy surveillance, which of course produces credible longitudinal legal data in a short time frame. So you'll also remember from part 1 of this series that policy surveillance is the systematic collection and analysis of laws. At our center, we focus on laws and policies of health significance. But this process can really be translated and used to analyze any area of regulation. And the wheel on the screen represents the steps of the policy surveillance process. The process contains 8 discrete but iterative steps. And unlike traditional legal practice, the policy surveillance process uses transparent scientific methods and rigorous quality control to create data that can be used for evaluation. So let's discuss how we actually created the legal data for this project. Well, before explaining how we created the data, we should really discuss who created the data. Evaluating the effects of law in public health and tracking those effects over time requires many different skills. Some examples are designing and conducting quantitative and qualitative evaluation research, legal research, and a close understanding of public health and legal systems. It's really rare for one person to have all of these capacities. And due to this, it's ideal to create a transdisciplinary team, echoing what Scott has just discussed. By transdisciplinary, I mean sharing tools, methods, and concepts across professional disciplinary lines. For this project, we were really fortunate enough to have a team that included economists, statisticians, epidemiologists, lawyers, and academics. My team at the center, the team that was responsible for creating the legal data, was comprised of 5 lawyers. So we had 3 legal researchers and 2 supervisors on this project, and I was one of the supervisors. So now we can really discuss how the data was created. And step 1 of the policy surveillance process is scoping, which is just defining the topics and parameters of your project. Now, the minimum wage project required a minimal amount of scoping. The goals of the project were clearly defined at the outset. We already knew the topic of interest, which was minimum wage laws, the time frame to be studied, which was 1980 to 2016, and the level of law to be looked at, which was state-level minimum wage laws across the entire United States. This gave our team the ability to jump right into step 2 of the policy surveillance process, which is background research. And this consisted of the team diving into the existing literature and writing background memos on the legal landscape. They were really trying to figure out how is minimum wage regulated at the state level and where are there gaps in the existing literature. After these background memos were written, the team wrote state policy memorandums. And the state policy memos consist of the legal researchers independently exploring the law in 5 states each. So while writing the state policy memos, the team discovered how often the laws change over time, trends in the laws, and also key features of variation among these laws. So during the background research phase, the researchers refine and revisit the scope as needed, and it's important to note that this process is iterative. So after the supervisors, including myself, reviewed these state policy memos, we realized we actually did need to refine our once clear scope. Originally, the data set included state-level law only. However, we realized federal preemption is a huge issue in the literature on minimum wage laws. So preemption means at its root that any federal law trumps any conflicting state law. Due to this, we quickly decided to scope in federal law into our minimum wage data set. And from a practical standpoint, this meant that we had to find, read, collect, and analyze the federal law that controls minimum wage from 1980 to 2016. So after jumping over that roadblock, we were able to develop our coding questions. You can see some crucial tips that we used to draft the coding questions on the screen. And although they may seem commonsensical, I'm going to go through just a few. So you always want to ask one thing at a time, and at all costs avoid compound questions. Again, a reoccurring theme is that this process is iterative. The questions and the responses will evolve as the researchers begin to code your questions and also as the researchers code more jurisdictions. Another tip is to consult a subject matter expert to review your questions once they're drafted. They'll be able to tell you whether you're missing key features of focus or even mischaracterizing important terms of art. The most important tip on the screen, in our view, is to create questions that ask for observation rather than interpretation. And you can see an example of this right on the screen. So a question that calls for observation is there a state minimum wage law? A question that calls for interpretation is, does the state have a good minimum wage law? So we developed the coding questions, and next we needed to collect the law and create the actual legal text used to code the law. Collecting the law consisted of the researchers following a systematic process to collect the body of law for all relevant state and federal citations. So once this body of law is collected, the researchers must organize it into legal text. This will leave you with multiple legal texts for each jurisdiction from 1980 to 2016. So illustrated on the slide, you can see that we will create a new legal text every time a new law is enacted or a current law is amended. The minimum wage data set contained 1,727 distinct legal texts. And as you can imagine, when you're dealing with that many separate bodies of law, you really need to stay organized. So it was during this project, in fact, that our center started to develop tools specifically tailored to create longitudinal legal text for policy surveillance projects. So an example of one of the tools that we use now in every single project is called a master sheet. So what is a master sheet? A master sheet is simply a comprehensive list of important information about laws that are relevant to your project. That information includes all of the citations, the statutory history, which is a list of all amendments to the law, and the effective dates. And the effective date is the date that the law actually went into effect. We create one master sheet per jurisdiction, so every state in the U.S. will have its own master sheet. And this tool, along with others that have been created for this process, can be downloaded right at Law Atlas. So after you create your legal text, you're ready to code the law. And coding the law is simply using the legal text you created to answer the questions that you've already developed. And the goal of coding is to read, observe, and record the law rather than read and interpret the law, which can be hard for some lawyers as we are used to interpreting the law. At our center, we store and code the law using the Monocle. And the Monocle is a software coding platform designed for this policy surveillance process. So as you can see, the law is stored on the right side of the screen, and the coding questions you created appear on the left side of the screen, and you code right within this software platform. So our 3 legal researchers on this project coded each of the 1,727 records. Now, with so many records of law and 3 separate legal researchers with 3 separate legal minds, quality control is crucial to creating reliable legal data. Quality control pervades throughout the entire policy surveillance process, but it takes center stage during the background research and coding phase of the process. So the 3 legal researchers independently researched and independently coded a random sample of laws. Then the 2 supervisors checked the redundant research and coding. The supervisors then recorded every single divergence between the researchers, and then the team met as a group to discuss and resolve each individual divergence. The supervisor then records all of these quality control measures in a research protocol document. And our research protocols outline the entire methodology and process of a project, including the quality control measures. So at this time, it's important to note that we complete each step of the process in batches of 10 jurisdictions at a time. The goal behind that is that the number of divergences will decrease as each batch of 10 states is completed. And this is because you're resolving divergences as they come up. And when you resolve divergences, you end up clearly defining your coding scheme. You end up refining your questions and responses, etc. So once the quality control process for all jurisdictions is completed, your data set is finished. So if you picture policy surveillance as a mountain, you only have to climb it once. You never need to rescale. After some time had passed, we were actually able to efficiently update the minimum wage data set with a whole new team of legal researchers. So before we delivered this data set, we wanted to do one last update to see if there was any change to the laws that we had collected. Now, the new researchers knew the scope of the project, what search string to use, what coding scheme decisions to follow, just by reading our detailed research protocol. Now, during this update, the researchers collected and coded all newly enacted and amended law. Then we performed quality control by redundantly and independently coding all of the new legal records. We ended up doing a final check of the data against the Department of Labor statistics. And so we were able to update this very large data set in less than a month's time. We then delivered Kelly's team the longitudinal data in Excel with the accompanying code book that you see on the right. Now, the code book just simply defines the variables and values that are included in the project. And thanks to the policy surveillance process, we were able to create the baseline legal data needed for Kelly's team to evaluate whether minimum wage laws have any effect on infant and child health. So without further ado, I will pass this over to Kelly, who will talk about the legal evaluation.
Thank you, and good afternoon, everyone. Let's see. So I'm obviously trying to work to forward the slides. Okay, here we go. So I just wanted to remind everyone, I know Jen introduced me nicely in the beginning of the webinar, but I come to this policy research from having conducted nearly 25 years of intervention research. My focus has always been on child and adolescent health promotion, and I've basically spent most of my career doing these group randomized trials where we randomize whole communities or schools to receive a multi-level intervention. From this experience of partnering with a vast amount of different communities across the country, really, that are really suffering from health disparities, I have been drawn more and more towards considering the social determinants of health. And that is what has brought me to this line of research. Let's see. So I'm going to begin just with a couple of conceptual slides. And this first one is a conceptual overview of social determinants of health. This figure is the conceptual framework that was developed by the World Health Organization's Commission on Social Determinants in 2010. The framework, as you can see, the framework shows how social, economic, and political mechanisms give rise to a set of socioeconomic positions. And these socioeconomic positions in turn shape specific exposures to determinants of health. And if you take your attention back to the left side, the left column, context they define very broadly to include all social and political mechanisms that generate and maintain social hierarchies. And one example of a contextual factor are really these federal and state family economic policies that are the focal point of my current research. This next conceptual model is really a simplified version of the Commission's framework, but very specific to our project, looking at these family economic support policies. And you know, here just showing again how these family economic support policies give rise to a set of social conditions that then shape exposure to health compromising environments and vulnerability to health compromising behaviors, which in turn affect health outcomes. And in this project, we are really taking advantage of what we call our experimenting society. That is, there's great variation of policies across the U.S. states and across time, which allows us to rigorously evaluate the effects of these state laws on health outcomes. So before I go into the research design and outcomes of this specific study, I'm going to first just spend a couple of minutes reviewing some design issues. Oops, I think I went, didn't I have, I just want to back up one slide. Oh, sorry. I think there was a slide missing, but that's okay. Let me just go forward again. The slide I thought I had in there was just a picture of, well, right there on the right-hand corner is the picture of the public health law research book that I wanted to draw everyone's attention to. In 2013, Alex Wagner and Scott Burris edited this important book on both theory and methods for public health law research, and I highly recommend it to those interested in pursuing this line of research, as it provides great detailed information on both theory and the research methods for analysis of looking at population health effects of laws. So when we are considering rigorously evaluating the population effects on laws, it really fits into this framework of natural experiments. A natural experiment is an empirical study in which individuals or clusters of individuals exposed to a treatment in control condition are determined by factors outside of the control of the investigators. So clearly, when we're looking to study the effects of laws on health, this fits into this framework of natural experiments. Evaluation of the effects of policy or law requires comparison of a situation with and without the law, or a treatment in control condition. And so, well, I mean, I guess I should point this out. Given my background as an interventionist, I clearly come from evaluating the effects of laws. I really consider the laws as an intervention. So that's the perspective that I clearly bring to this. So we know, I think we all know, that random assignment was a major advance in experimental research, yet it's rarely available as a design option to us when we're studying the effects of laws, because passage and implementation of law is generally not under the control of scientists. When passage and implementation of a policy is not under the control, we therefore can conduct natural experiments. Now, we really argue that there's an incorrect dichotomy of strong experimental studies, that is randomized controlled trials, and weak observational studies, including natural experiments. We view random assignment as one of many design elements that improve causal interpretation of an observed difference, and that combining many design elements into a single study can produce evaluations with high validity and strength of causal inference. And just the visuals, oh sorry, the visuals on the bottom of this slide just show, are depicting, we have a long, rich history of impactful law studies that have evaluated the effect of laws, and then the evidence from those studies led to more dissemination of those laws. This has clearly been the case in alcohol and tobacco control policies, and of course now being applied to obesity prevention policies. And what my colleagues and I are now doing is applying these same methods to the study of laws that affect fundamental social determinants of health. Okay, so the next slide. So I'm just going to briefly review the design elements that are important for strengthening causal interpretation of natural experiments. These design elements are not only relevant to natural experiments, they're also relevant to randomized trials. And please see my note on the bottom of this slide is the book by Shadish, Cook, and Campbell, which provides a really important and helpful resource for anyone designing experiments and quasi-experiments. So let me just briefly go over these. So the first is many repeated measures. Collecting dozens or hundreds of observations in a time series before and after a new law takes effect makes it easier to see what the pattern of outcomes is, and if it changes at the exact same time as a law goes into effect. So having many repeated measures of the outcome enhances confidence that an observed difference occurring just at the time of a new policy takes effect is actually due to the law. Another important design element is functional form of effects. So this is really where the theory comes in, where it's important to hypothesize the expected pattern of effect over time. So based on our theory, do we expect there to be a gradual change in the outcome and a abrupt change in the outcome? And then if the observed pattern of effect closely matches what you hypothesize, this again increases confidence that for your causal inference. And then we have three design elements that are related to comparison. So the first and most important is the comparison jurisdiction, and this is one that most people are quite familiar with. This is, in our randomized trials, we have our control group. In quasi-experimental or natural experiments, we talk about comparisons. So these are having comparison jurisdictions that we somehow match to the jurisdictions that had a policy change, and we're able to look at the pattern of outcome over time in the jurisdiction that had the policy implementation versus ones that did not. But we can also apply this concept of comparisons to not only jurisdictions, but also to groups and outcomes. So for groups, this is if a law targets a particular group of people or organizations within a jurisdiction, and so that becomes the focal group. And then you might be able to look at other groups and to hypothesize that no change would be seen. I mean, an example would be perhaps if there were zoning rules that prohibited the building of elementary schools next to highways to reduce air pollution exposure and asthma, and if it only applied to elementary schools and not high schools, a comparison could be made across those different groups. Comparison outcomes is an additional option where there might be an outcome that's related to your primary outcome, but it is hypothesized not to be affected by the law or policy, and you can look at the pattern of effects over time to see if they are in the hypothesized direction. Replications is a fundamental way to strengthen causal inference. So if we see a replication of policies across jurisdiction over time and we are observing similar effects, this provides confidence in the inference we're drawing from those studies. Dose response is similar and related to your theory. If you see a pattern in the hypothesized level of effect of an increase in dose, and if this affects also, if the dose varies by jurisdiction or over time, you can observe a dose-response relationship. And the point here is just to creatively think through all the different design options that are available and combine design options to most rigorously evaluate laws. In most cases, when randomization is not feasible, using matched comparisons, including jurisdictions, groups, and outcomes, in combination with many repeated measures is highly recommended. Okay, as with any experiment or quasi-experiment, there are three main buckets of variables to consider for studying, for evaluating the effects of laws on public health outcomes. As Lindsay described clearly, the independent variables here are the legal data sets. Equally important are considering measures that are available for your dependent variables, for your outcome variables. And in my study that I'll be presenting today, we are relying on national mortality and natality data files that are available from the CDC. We chose these because they are a uniform data collection across states and across time. And then the third bucket is measures of mediators or mechanisms. This could include implementation processes or also measures of proximal and intermediate outcomes. Okay, I'm going to go into the next slide. It doesn't seem to be forwarding to the next slide for me. Whoops. Okay. Okay, so now I'm just going to spend the last few minutes talking specifically about this study that was funded by the National Institute on Minority Health and Health Disparities. This project actually included 4 family economic security policies. So minimum wage is the one I will discuss today because that was the first one that we tackled. And we also are including state level earned income tax credit, unemployment compensation, and temporary assistance for needy families. This figure just is a map of the U.S. showing the current variation in state minimum wage laws across the states. So the dark blue states have the minimum wages above the federal rate of $7.25. The dark gray states have state minimum wages at the federal level. The light blue states have state minimum wages below the federal, and the light gray do not have a state minimum wage. So this is just a snapshot in time, and in our study we're looking across time and across the states. And for this study, we selected infant mortality and low birth weight as the outcome for the study because they are health outcomes that are very sensitive to socioeconomic conditions. For example, the U.S. excess infant mortality rate during the postnatal period, that's days 28 to 364, is driven almost entirely by excess infant deaths among mothers of low SES. Low birth weight is also a sensitive consequence of low income, and it has been established as one of the most important predictors of infant mortality and also increases the risk of negative health and economic effects into adulthood. And alarmingly, more than 1 in 4 women giving birth in the U.S. are below the poverty level. The minimum wage standards are an important potential contributor to family economic security and therefore may influence maternal and health outcomes. It's important to note that the current federal minimum wage is not sufficient to lift a full-time worker with 1 or 2 children above the poverty threshold. And women, those with low educational attainment, young workers, and those in the service industry are more likely to be paid the federal minimum wage or less. So in this study, we've taken advantage of the natural experiments and minimum wage laws across states and time over the past 30 years to empirically evaluate the hypothesis that an increase in state minimum wages are associated with reduced rates of low birth weight, infants, and infant mortality. So the main independent variable is the state level minimum wage for each of the 50 states by month from 1980 through 2011. Over this period, we coded 206 legal changes in state minimum wages across 33 states. with values ranging from $5.58 to $10.44. Okay, the next slide. Sorry, I think I'm not controlling. Someone's moving them forward here. So this is just an overview of the analysis. So we have the dependent variables of interest that I described. We did a difference in difference analytic approach. We adjusted for inflation and expressed all in 2011 dollars. Importantly, we included state and year fixed effects in the model. Let me just take a moment to explain this. The year fixed effects account for any changes over time in infant outcomes common across the states, so any secular trends that are occurring in these infant outcomes. And the state fixed effects control for any time invariant differences between states. Thus, this design efficiently controls for a host of other factors affecting the outcomes, both measured and unmeasured. Remaining covariates that are a potential threat to validity are only those that change close in time to a state wage policy change and only in that particular state. However, to be conservative, we also included a few covariates in the models in addition to the year and state level fixed effects, and that included the percent African American, mean age of mothers, poverty rate, and cigarette sales. Next slide. So this is the results on the minimum wage on the effect on low birth weight births. And if you just take your attention to the very last column to the right, the percent change. So our results were consistent across all the models we tested, and are basically what is shown here is that $1 increase in the minimum wage above the federal is associated with 1 to 2% decrease in low birth weight births. And then in the next table are the results of the effect on postneonatal infant mortality. And again, if you draw your attention over to the right column, across all the models, $1 increase in the minimum wage above the federal level is associated with a 4 to 5% decrease in postneonatal mortality. And then the next slide. So we then converted this into what this means. So if all states in 2014 had increased their minimum wage by $1, we estimated that nearly 3,000, there would be just less than 3,000 fewer low birth weight births and 518 fewer post-neonatal deaths. So the results provide empirical evidence that increased minimum wages are associated with reduced low birth weight births and reduced post-neonatal infant deaths. And for this project, our next steps now, Lindsay and her team have completed the data collection for the Earned Income Tax Credit, and we are working on analyzing the effects of the Earned Income Tax Credit on these same outcomes. We will then combine and look at the effects of minimum wage and the Earned Income Tax Credit and see if there's any interaction between those two. We're in the process of working with the legal team on collecting the unemployment compensation. And so that's kind of where we are with the project. There's lots of interest here in the Rollins School of Public Health among the students that are using the data sets to look at the effects of these policies on other health outcomes as well. So thank you very much. I look forward to discussion.
Great, thank you so much, Kelly, and also Scott and Lindsay. This was great. So just as a reminder, if folks have questions, if you want to enter them into the chat box, we have just a few minutes, so we will we'll do what we can to answer the questions. But if not, certainly when we send out the slides, we can make sure that contact information is included and you can follow up individually as well. So one question, Kelly, that came up with regards to the results, you talked a little bit about next steps with the research part of it, but what are your thoughts in terms of now taking these study findings and being able to make a policy impact? What are the thoughts in terms of who you could be approaching, sharing that information to move from the research to the translational piece?
Well, I actually was quite disappointed when the results, we published the minimum wage results, and it was during the presidential campaign, actually, and when they came out the summer right before the election. And I thought, we release press releases, and it didn't get as much attention as I would have hoped. But we're continuing to, to work on that piece of it. And I would appreciate anyone's advice on that translation.
Great. I think that's sort of the $64 million question. Everybody's looking for that same, how can we be able to do that? So certainly opportunities to share is always a good idea.
Well, and I should say I just recently joined the board of National Prevention Science Coalition, and this is it's a group of prevention scientists that are doing exactly this, putting a little bit more time and attention into creating congressional briefings and offering them in DC. And so I'm waiting to have multiple of these papers published, so we have a bigger picture than just this minimum wage, and then likely putting together a congressional briefing. And of course, the most relevant though is to the state legislators. But of course, these are state laws that are also federal laws, so it has implications for the federal policy making as well.
Great, thank you, Kelly. Another question that came in: when modeling these outcomes, how do you control for state culture, such as a conservative versus liberal legislature, that may affect whether these laws are or are not passed?
Well, right, that's where, I kind of briefly went over, including the state fixed effects are, in essence, controlling for those differences between states. So I think, that's how we control for those state variables.
Exactly, and in the fixed effects, being able to control for a number of state culture issues, not just the political leaning of the legislature.
Right, right.
Scott, a question for you. When trying to sort through and determine what theory you could be using, can you say a little bit more about where to start and how you start thinking through comparisons of which might be the best theory to drive what your mechanism is?
Well, I think the first place to start is to think in a transdisciplinary way, which is to be a scavenger, to think about the behavior. You can certainly look at other studies and look at people who've talked about how this effect happens. So that's one way. Another thing, so you're going to get some candidates that way. Or talk to people in different fields about how they would think about this problem. Or start with where you are. Start with the theories you already used. And the next step that we find really useful, and we talk about in the book, is logic or causal modeling. Try and work through the steps you believe will happen if you apply that theory of behavior change or environmental change to this legal intervention, and see where that takes you. I'm definitely a believer in the idea that many theories can be useful and no theory is perfect. So, I encourage conversation, sharing, and experimentation as you move towards trying to understand. What really is helpful is what Kelly pointed out, which is know what you're looking for. You're looking for something that gives you that sense of the functional shape of the effects. You're looking at something that's going to give you a sense of when the effect is going to happen and what you can observe. And if your theory is yielding that, that's a good start.
Great. Thank you, Scott. Another question that came in, then Lindsay, you might be best to address this. A general law atlas question. Can anyone share if there are other topics in the pipeline? If you want to talk a little bit about things that are going to be coming forward shortly, and there were two questions specifically asking about health IT laws.
Sure. So we actually just released a study for longitudinal data sets on health impact assessments and health in all policies at the state level, where we actually looked at all bills and laws from 2009 until present day. So that was just released last week, along with 2 environmental data sets that were created by an external user at CUNY on radon and T-norm laws. Data sets that are in the pipeline are the ones that are the hottest topic would be about targeted regulation of abortion providers. And that's also 4 data sets that look at laws regulating abortion providers. We do not have anything on health IT in the pipeline, but we'd be interested in that person reaching out and sharing their ideas because we're always looking for collaborators.
Great, thanks, Lindsay. And I think that's a good point in general. If you have suggestions for topics, if you're looking for collaboration, if you have more questions, Lindsay is an outstanding resource and really has her finger on the pulse in terms of what's emerging, new projects that may be coming out. So certainly a great resource.
Also,
so
I think last week we mentioned some of the other key ones like APHIS, the Alcohol Policy Information System, PDAPS, the Prescription Drug Abuse Policy System, the state system that for cigarette laws, the tobacco law that CDC has. There's more and more good legal data out there.
Great. And Scott, I think that is a perfect way to conclude. I'm mindful that we are at the top of the hour. So again, thank you to all of our presenters today. I would encourage folks to follow up with individual presenters if you have questions. Again, the webinar was recorded and ASPPH will be sending out the link and certainly also being able to go back and reference the webinar from last week. So thank you everyone so much and we look forward to future conversations around public health law research and legal epidemiology.